So the patient is a 24-year-old female. She was in a motorcycle accident and obtained TBI. She was admitted to the hospital for a left frontal laceration and a linear skull fracture. While she was in the hospital, she had increases in her intracranial pressure and developed severe spasticity throughout her hospital stay. CT scans revealed edema, right basal ganglia contusion, and a skull fracture. She was comatose upon admission. A gastric tube was inserted during the hospital stay and then taken out before she got to rehab. Her neurological status did not improve while she was in the hospital. And then after 4 weeks of the injury, she was transferred to rehabilitation. Her current medications are 200 milligrams of Tegretol, which is an anticonvulsant. She takes multivitamins and a stool softener. Currently, before the accident, she was a graduate student in the physical therapy program at a local college. Her parents lived 2 hours away. Her mom took off work to come and take care of her in the hospital. And her patient has primary insurance through her parents, and it covers inpatient and outpatient rehab. She's within normal limits on her lower extremities, except her right ankle dorsiflexion is 0 to 5 degrees, and her left ankle dorsiflexion is 0 to 10. Upper extremities, she's limited in elbow flexion on the right and elbow extension on the left. She's a modified Ashworth scale level 4 in her trunk, 3 on her right side, extension tone in her right lower extremity, extension tone in her right upper extremity, left upper extremity is flexor tone 3, and then left lower extremity is a 2. Her right lower extremity is spontaneous and non-purposeful and out of synergy. Poor sitting balance, poor dynamic balance, and she's a max assist of 2 to be in the parallel bars to stand. She's currently incontinent and has an external catheter. She's a level 5 confused, inappropriate on the Rancho's levels of cognitive functioning, able to respond to simple commands, highly distractible, and it's hard to focus on a specific task. And then she gets easily frustrated and responds with inappropriate behavior. So limitation in activity is sit to stand. So the reason we're working on sit to stand is because she has a kyphotic posture due to her trunk flexion. So we want to facilitate trunk and hip extension. We also want to increase strength in her hip abductors and extensors, as well as her core musculature for future transfers. She needs to be able to do these sit-to-stand transfers for toileting, and then when she goes back to being a student, students typically sit to stand from different services throughout the day, so she needs to be able to do this when she goes back to school. My interventions are bridging and PNF on the right lower extremity. So the intervention of bridging addresses the impairment of the MAS level 4 spasticity in her trunk. So the bridging will help with the hip and trunk extensors through weight bearing on her lower extremities. It also facilitates approximation through the ankle and the knee, and which facilitates the hip extensors. She'll have to recruit her glute max and her hamstrings, which will help her with the sit to stand in the future. And then PNF on the right, I chose rhythmic initiation to improve her motor coordination because she is spontaneous and non-purposeful and out of synergy on the right. So this technique will allow her to have increased motor coordination in her right lower extremity. It also promotes relaxation, which will help with the spasticity in her extensors. So I chose spasticity over the trunk over other impairments because it is essential for safe functional mobility and prevention of injury due to fall from forward posture. It is also essential to have adequate trunk extension when balancing and sitting or standing in order to keep your center of mass over your base of support. And then I chose synergy/motor coordination in the right lower extremity over other impairments because it is essential in initiating safe transfers to progress towards functional independence in the future. And she also must have proper motor coordination in her right lower extremity in standing. I think that's it.